Faith can be expressed as, God, I know you know, and I'm coming to you to let you know that I need help. In this particular case, a man with Hansen's disease, which you know is leprosy, which is a very destructive and socially ostracizable condition. He came to Jesus and humbled himself and said, if you're willing, you can make me clean. And whatever it is that is tough for you to have faith about, speaking to God about, I'm coming to you, and saying, if you're willing, you can resolve this. And then waiting to hear. In this particular case, Jesus said, I'm willing. And I appreciate his encouragement to live by faith. Without faith, it's impossible to please God. So I'm saying choose faith in him. Choose faith in him. And let's watch him do the miraculous. We're headed into a study of cardiomyopathy, where the heart muscle is diseased, and there's 3 different types of cardiomyopathy: dilated, hypertrophic, and restrictive. This is available to you on PowerPoint, on the module that's linked just below cardiovascular module. The first one we're going to deal with is dilated cardiomyopathy. This is a heart, the muscles of which have gotten way saggy, and you can see the normal heart with highly muscular. This is dilated. It's just been so distended. As a matter of fact, I'm intrigued by the treatment for dilated cardiomyopathy is actually putting a jacket around the heart to limit the size of this dilation so that the heart can move more effectively. I'm not going to read this to you. Etiological factors include some things that we can avoid that keep our heart strong and supple. There's an ethnic linkage to people who tend to have this, people who have dark pigmentation and who are in their 4th to 6th decade. Signs and symptoms are provided for. You can imagine that these people are not moving enough blood, and so there would be fatigue. The prognosis is not very good. High morbidity and mortality. A very tough diagnosis is hypertrophic cardiomyopathy. Sometimes in our most fit people, really high performance athletes, the first sign that they have this condition where the muscle has so overwhelmed the organ that the chambers have gotten small. Yes, this is an expression of compared to the normal, and this is not a frequent occurrence, but this results in sudden death. And on the PowerPoint is a YouTube video of a man who's experiencing his last movement. He was a high-powered basketball athlete that your folks, the people who follow basketball back in the day, would know, Hank Gathers. And so there can be some signs and symptoms that are prodromal, but it's possible for the very first sign to be sudden death. So be a student of that in your reading. Restrictive cardiomyopathy, really this is a sclerotic condition where the heart becomes rigid and doesn't pump effectively, and you can imagine that blood pressure would be high. They have difficulty breathing, and they tend to develop ascites. And then the great vessels of the heart can be congenitally predetermined to be inverted. It's called transposition of the great arteries. TGA. And if you follow this illustration in PowerPoint, you'll see that the vessels are reversed for sending blood to the general circulation and the pulmonary circulation. So deoxygenated blood is being circulated through the aorta, and oxygenated blood is being sent to the lungs. So this would necessitate a reversal fairly early in the child's life. Certainly septal defects where there's, in quotes, the euphemism, holes in the heart. There's communication of blood between the atria or between the ventricles. Relatively straightforward surgery, high rates of success. So these are things that being aware of, particularly if you're a pediatric physical therapist or physician assistant or medical doctor. And then heart rate and rhythm. We need to be students of this. We're going to work on this a little bit in class on Thursday. The 3 sounds of the heart that I want you to be way clued into. There's lots of different pathologies that can lead to different sounds as we auscultate the heart, but I want you to know the normal sinus rhythm, the sounds that are normal sinus rhythm. That's lub-dub, 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 lub-dub. Contrast that with a stenosis. Now the stenosis can be at any valve where the valve is too small and there'll be a so it would be lub-dub, lub-dub, lub-dub. And also a regurgitation where there's lub-sh-dub, lub-sh-dub, lub-sh-dub. That means that the valve is not keeping the blood from backwashing into the previous chamber. And then rate, I've provided for you. We'll be doing pulse rates in class, and I just want you to be aware of typical resting rates for different sized human bodies, from fetus to adult. So take that in. And then arrhythmias, we need to be students of when the rhythm of the heart becomes abnormal. Actually, so here we are, lub-dub, lub-dub, lub-dub is the typical. A fibrillation, in contrast to that, is not meaningful movement of the heart muscle. So really no oxygenated blood is being circulated. It's just a bag of worms, and that's why in this particular case a defibrillator is needed to put an electricity through the heart, and then the execution of heart compressions can restore the normal rhythm of the heart. A very fast heart expresses tachycardia. A very slow heart is bradycardia. Had an athlete one time who had atrial fibrillation. Her heart would race. She was a tremendous volleyball setter, but her heart rate would get in excess of 200, and it made her just feel so weird and not able to function. And this is called a Holter monitor that they would wear over a 24-hour period, and it records and can transmit what that heart rate is to try to determine what's causing that. And it could be the AV node or the atrioventricular node, or the isn't that funny? Drew a blank. The 2 nodes that are the electrical starters for the heart. The SA node, of course, it's right here in print. Sinoatrial node. Sorry to let you down. Hey, then the valves. The aortic valves, the tricuspid valves, and the bicuspid valves. If they don't open all the way, or if they don't close all the way, there's threat to efficiency of the heart. And so we need to be aware of maybe congenital anomalies that cause this, or disease processes that result in this. This actually is a typical tricuspid valve that, because this leaf was never freed up from this leaf, it only functions as a bicuspid valve. So there's going to be resistance, blood pressure is going to go up, and this can wear out. Stenosis, this is a typical tricuspid valve. This is called a fish mouth. It's stenosed, again, so there'll be resistance. When there's a leaky valve, it doesn't seal all the way, the blood regurgitates, and so it's an inefficient system for circulating oxygenated blood. When we were dealing in the integument, we talked about rheumatic fever. Starts with strep throat, can lead to this strawberry rash, and then it can lead to bicuspid valve disease known as infective endocarditis. This is rheumatoid disease, and so a kid that starts with strep throat moves to scarlet fever. This bacteria has an affinity for this valve and actually grows what are called vegetations, and it overwhelms the mitral valve, and that heart becomes weak. They become very fatigued, and the signs and symptoms are listed for you on your PowerPoint, so be aware. I point out to you that hemoptysis is blood in the sputum. Petechiae is little subcutaneous bleeds that are purple. Certainly we talked about congestive heart failure, night sweats, fever, and other symptoms related to hypoxia, which would include clubbing of the fingers, and it can lead to joint pain. And then pericarditis, you know, the pericardium surrounds the heart. This can become infected. I've got a granddaughter right now who's got a viral infection here, and her heart will race, and we're just waiting for her immune system to knock down the infection. People vulnerable to this are people who've developed an infection, they've had an MI, or they are autoimmune suppressed. I want to talk to you about violent trauma to the chest that can lead to cardiac arrest. People die from myocardial infarctions and from rhythm changes. Okay, there can be valvular things or septicemic infections of the heart that can lead, but this is a change in the heart rhythm where the heart stops. And there's a video available to you on PowerPoint that's on E-Class, where this man got kicked in the chest, his heart stopped, and he never recovered. When the arteries have weak places in the wall, the pressure of the blood will cause aneurysms to form. And then diseases of the peripheral vascular system, I think this is self-explanatory as you read about this in Goodman. Inflammatory diseases, occlusions, and venous disorders. And then arterial insufficiency, that's a result of peripheral vascular disease. So it's such an intriguing area of study. Lord bless you as you work on this. Bye.